Hi everyone, Whitney Lowe here, and today on our Clinical Insights video, we're going to be talking about pain on the bottom surface of the foot. In particular, we're going to look at two conditions which both cause pain on the bottom surface of the foot, and they can easily be confused with each other. One is pretty common, and you've probably heard about that before, and that's plantar fasciitis. And the other is a nerve compression condition called tarsal tunnel syndrome. It's nowhere near as common as plantar fasciitis, but a lot of times people may have pain in the exact same spot and it may easily get misdiagnosed as plantar fasciitis because somebody didn't go through a thorough and comprehensive evaluation and identify the potential for tarsal tunnel syndrome. Now, one of the reasons that this is particularly important is because we're going to treat these two conditions a good bit differently. So it's important that we recognize what we're dealing with in order to address it appropriately. So let's take a look at what goes on in each one of these different conditions, and then we'll talk about some of the signs and symptoms associated with them, and then look at some of the treatment parameters that will be necessary to address them. So we're going to first take a look at plantar fasciitis and what goes on in that particular condition. So as its name implies, this is a condition affecting the plantar fascia. So here, let's take a look at the bottom surface of the foot where the plantar fascia is located. This is a tight band of connective tissue that goes from the anterior part of the calcaneus right here, all the way down and splits and divides into the individual metatarsals down here. Now, its primary function is really to act kind of like a spring and to give power and propulsion to the foot and also to absorb shock. So essentially, if you look at the architecture of the foot, the bones are in this sort of curved longitudinal arch like this, and then the plantar fascia runs right underneath them to act like a spring to hold and support that arch. So the downward force of the body's weight that's pressing down here has to be supported, and this plantar fascia acts like a spring to hold it in position. Now, one of the things that occurs with plantar fasciitis is an irritation from overuse where that spring is overloaded. Just like any structure that's being supported at both ends, the general area of tension where the high tensile force loads are the greatest are right where that plantar fascia attaches into the bones. Now, on this end of the foot down here, notice that tension is spread out across the 5 metatarsals, so there's not an overload of force in any one particular area. However, over here at this end of the plantar fascia, it's all concentrated in the anterior calcaneus. So this is one of the things that occurs in plantar fasciitis is an overuse and overload of that tensile forces on the plantar fascia. Now, the attachment side of the calcaneus is where that tensile load gets concentrated. But the term plantar fasciitis may be a little bit misunderstood because that does imply there's an inflammatory problem here. And some of the recent research about this condition has indicated that this may be more of a chronic overloading of this structure and may not have as much of an inflammatory component in there. That is important because when it gets to our treatment concepts, we want to focus on the things that are going to be helpful, and sometimes anti-inflammatory medications or anti-inflammatory treatment strategies which have been advocated are not the best things to address that. Now, undoubtedly, you've heard of carpal tunnel syndrome, which is, of course, a nerve compression problem that occurs in the wrist. We actually have a very similar situation that occurs in the foot. So this is a right foot, and we're looking here on the medial side of the right foot. So there's a number of tendons that come down through this area, and they curve around the underside of the medial malleolus. This is the tibialis posterior, flexor digitorum longus, and flexor hallucis longus tendons. And you can see they're enclosed in these synovial sheaths right here as well. So the sheath is visible, the tendon's not visible in this particular picture. But along with those tendon sheaths and right beside them comes a branch of the tibial nerve, which comes down here and it goes underneath this connective tissue band here called the flexor retinaculum. Now, the flexor retinaculum is sort of a binding connective tissue that holds these tendons in place and sort of helps them act like a fulcrum, but that also means it produces a very narrow channel in here for this nerve to pass through. And this is the tarsal tunnel. So right where that nerve is going underneath the flexor retinaculum alongside those tendons, this is the tarsal tunnel. Let's just fade this a little bit and we can kind of see. We'll zoom in a little closer. We can see that nerve and the faded image of the flexor retinaculum over the top. And here are those tendons that are right next to it. Now, just like in carpal tunnel syndrome, in tarsal tunnel syndrome, this nerve can get compressed either by inflammation, excess tissue fluid, chronic overuse, biomechanical stresses, and a number of other factors. And this nerve comes down here and branches and then divides here and goes into the medial and lateral plantar nerves. And we're going to just turn this foot a little bit so we can see those nerves as they go down into the bottom surface of the foot. So you can envision here, if you've got a compression of this nerve in the tarsal tunnel region, you're going to have symptoms along the distal part of that nerve, which is these branches of the medial and lateral plantar nerves. And that'll cause pain on the bottom surface of the foot. Now, if we lay that plantar fascia back on top of it, we can see it's also lying directly over the top of those nerves. So pain that's felt on the bottom surface of the foot here can often be mistaken for plantar fasciitis when in fact it is nerve pain coming from a compression of these nerves here in the tarsal tunnel. A primary characteristic that we'll look at is the fact that the plantar fascia pain tends to be more concentrated right here in this area on the anterior calcaneus. Now, one of the things that makes plantar foot pain a little bit challenging to identify when we're looking at both these condition possibilities is that the things that cause them are very similar. There's a number of factors such as chronic overuse in the foot where you're doing, let's say, a lot of jumping or running activities, muscle tightness in the gastrocnemius and soleus muscles. Those calf muscles that get tight, they can lead to that. Let's just zoom in here a little bit and we'll put those muscles on here and look at the role of the gastrocnemius and soleus. So here are those muscles of the triceps surae group, the gastrocnemius and soleus muscles. So those can get tight and they'll pull on the Achilles tendon. They may also alter mechanics of the calcaneus and put extra tension on that plantar fascia. So that tension line is transmitted here down the back side of the calf all the way down here, and then it pulls on the calcaneus, and that can put extra tension on the underside of the plantar fascia down here. Now, tightness in these calf muscles may also contribute to chronic overuse problems, as we saw in the tarsal tunnel with those other three tendons coming down here through the deep posterior compartment on the calf. Those three muscles which are coming down here, the tibialis posterior, flexor hallucis longus, and flexor digitorum longus. So chronic overuse, mechanical problems in here, flat feet, other kind of biomechanical challenges can also lead to that. Here's another thing that may also lead to some potential problems here. A condition called, or this is sort of a biomechanical structural alignment called calcaneal valgus. And so if we notice, they've got kind of a straight line right down here from the Achilles tendon down into the calcaneus. Now, sometimes people's foot will turn inward a little bit, and this is often true in a person who is overpronating. And we'll explore that in another video, what that actually means. Overpronation may also occur from alterations in position of that calcaneus. So, for example, this line will come down here, but the calcaneus itself might be deviating a little bit in a lateral direction like this, causing more of a tilt or a lean of that whole calcaneus. As you get that alteration and leaning of the calcaneus, it puts additional stresses on the plantar fascia, but it's also going to put additional tensile stresses on the tibial nerve as it comes through the tarsal tunnel. So that nerve is going to get pulled taut, and it may be compressing against other structures, and this will also lead to further aggravations of problems in there. Now, a couple of important characteristics to look for that will help us distinguish between these two conditions. First is the nature of that pain. With tarsal tunnel syndrome, this is a nerve compression problem. So symptoms tend to be things like sharp shooting, burning, and electrical type sensations, maybe even numbness on the bottom surface of the foot. And there can be a very sharp pain associated with weight-bearing positions and various other activities, standing on the foot for long periods or any kind of chronic overuse problems. And there's also likely to be some sensitivity, maybe even some sensory irritation, like extreme sensitivity to even a light touch on the bottom surface of the foot. Those are all characteristic indicators of a nerve problem. Plantar fasciitis, on the other hand, also has characteristic very sharp pain sensations in the foot, and a person who's ever had this will usually describe it as being very sharp, very severe pain sensations on the bottom surface of the foot. But a common characteristic is those sensations are aggravated when they get up first thing in the morning. So that tends to be when the symptoms are worse. Or if they haven't been loading that tendon, like they've been sitting for long periods, and then they get up and start walking around, those symptoms get a lot worse. And again, the location of those symptoms is really important. Note that the plantar fascia pain could be anywhere on the bottom surface of the foot, but it does tend to really be exaggerated right here on the anterior calcaneus. So if you press in on the anterior calcaneus region here, and it is exquisitely tender and really mimics the sensations that a person has been feeling, that's a greater indication of something that might involve the plantar fascia. The tibial nerve in the tarsal tunnel, on the other hand, is generally going to be more sensitive when you press and palpate the region right here on the tarsal tunnel. This is frequently done with an evaluation test called the Tunnel sign, where you basically just tap on this area of the medial ankle right here, just down below that medial malleolus on the side of the ankle, and see if you get that kind of funny bone-like feeling, like a sharp shooting, prickly kind of sensation when you tap on it. That generally indicates a greater degree of sensitivity of those nerves and may be indicative of a nerve compression problem in there. Now, when you palpate that area, the medial side of the ankle, that may also cause pain on the bottom surface of the foot. And do note, since the plantar fascia doesn't run into the medial side of the ankle, if you're getting plantar foot pain when you press on that area there, that's a greater indication or likelihood that you've got some involvement with the tibial nerve. Now, I said earlier in the video that one of the reasons that we want to try to make these distinctions between these two conditions is they can have very similar symptoms, but you could actually cause more problems by trying to treat them if you don't recognize which of these problems is really the primary cause of the pain. For example, people often treat plantar fasciitis with a lot of massage techniques that are addressed to the sole of the foot, which is a great idea. Broad contact surface and gliding techniques, fist rolling on the bottom surface of the foot, even, things that a person might do at home, like rolling their foot on a frozen bottle of water, all kinds of things, putting additional pressure and manipulation of the soft tissues on the bottom surface of the foot can be very beneficial for addressing the plantar fasciitis complaints. However, that can also aggravate a tarsal tunnel syndrome. Even if the nerve is not being compressed when you're up here, you're working on the bottom surface of the foot, that nerve is sensitized, meaning it's got increased sensitivity. So if you're working on the bottom surface of the foot and that is increasing any of those sensations of like the sharp electrical burning nerve type sensations, I would caution you not to do that type of specific work on those areas and try to keep it a lot more general and broad, and don't put significant pressure on there that aggravates any of those symptoms. Now, the home care suggestions that somebody's going to do to address this are going to be very similar. This, just like any other overuse condition, rest from offending activities is going to be very important. Stretching these tissues is also helpful and beneficial in many cases, especially with the plantar fascia and its chronic overuse problems. Stretching the foot in dorsiflexion is the best and most effective way to do that. So again, here's a real quick reminder. The dorsiflexion movement, pulling the toes up toward the knees in this direction, helps stretch that plantar fascia on the bottom surface of the foot. That will also, however, stretch the tibial nerve through the tarsal tunnel. So if that aggravates those tibial nerve symptoms, that may not be the most effective means of addressing that tarsal tunnel problem. But stretching can be beneficial in other instances. There's a technique that's frequently referred to as nerve flossing or neural mobilization, where you're trying to encourage freedom and mobility of that nerve by stretching it through those different directions and pulling it from one end and then eventually the other. So you'll pull it in dorsiflexion, and then maybe you'll pull the other end of the lumbar nerve roots where that nerve is originating all the way up in the lumbar region to try to make it sort of slide back and forth more effectively. Those would be some effective ways to address both conditions, and also some important cautions and precautions about how to deal with them. So if you found this video useful, I'd like to encourage you to like the video and subscribe to our channel so you can get more videos about some of the various different factors that are dealing with clinical and orthopedic massage problems. Also, if you want to get a better jump on trying to help identify what type of tissue problem is something that you're dealing with, hop on over to our website and grab a copy of our assessment cheat sheet. And that place on our website is academyofclinicalmassage.com/cheat sheet. That'll really help you get some good parameters for understanding how you make some distinctions about what type of tissue injury you're dealing with, and that's going to help you make the best treatment decisions and be the most effective in your treatments afterwards. So I'll see you in the next video.